So hello everyone, and today we will be discussing a spotter case. So here we have a 25-year-old male who presented with episodes of seizures and headaches since 3 days, and a contrast enhanced MRI was advised for the same. This is the CT scan axial section that I got done for this particular patient after getting the MRI done, where we can see this is a plain axial section of NCCT, where we can see this hemorrhagic contusion, intraparenchymal hemorrhagic contusion in the posterior temporoparietal region on this plain NCCT scan axial section. Now these are the MRI images. This is the T1 weighted image axial section, where the diagnosis is very clear. There is loss of flow void with hyperintensity in the left transverse and the sigmoid sinus, along with an iso-intense lesion in the draining territory, the temporoparietal region, which is hyperintense on T2 weighted images. Again, the flow void is lost on T2 weighted images as well. These are the GRE images where we can see intense blooming along the transverse sinus and also in the draining territory, suggesting hemorrhage in this particular area. These are the MR venography images, where we can see that there is no opacification of the left transverse and the sigmoid sinus, and the jugular vein is also less opacified, suggesting a partial thrombus even in the jugular vein. So this is the report that I had given. There was a focal area of blooming of size approx this, which appears hyperintense on T2 and flare and isointense on T1, noted in the left posterior temporoparietal region, with loss of normal flow void in the adjacent draining left transverse and sigmoid sinuses on T1 as well as T2 weighted images, with T1 hyperintensity within these dural venous sinuses, suggesting a subacute dural venous sinus thrombosis, along with hemorrhagic venous infarct in the left posterior temporoparietal draining territory. The left transverse and the sigmoid sinus do not show any enhancement suggestive of thrombosis, and there was reduced enhancement of the left IJV, likely suggesting partial thrombosis on the MR venography images.